Hey guys, welcome back to our channel, The Trippin' Family. Thank you for joining us today. We wanted to talk a little bit about some questions that we've gotten about how to prepare for slow traveling overseas. Um, we've had a lot of questions about healthcare. We were both nurses, as you know, Mark and I. So, one of the things that you're going to have to do to prepare if you vaccinate is to get your vaccinations or at least have a consultation on the vaccinations that are recommended. So, what we did not realize was that we needed to make this appointment way further in advance than we did. We waited too long to make the appointment because the travel clinic where we are from was only actually open on certain days of the week. And for pediatrics, for Cambry, was only open every other Friday. So that really limited the amount of time that we had to get her vaccinations to come and prepare for our slow traveling. What we didn't realize was that the pediatric clinic was only open every other Friday, and they also only saw 4 patients per day. So getting an appointment on that Friday was very difficult. We didn't have too many months to prepare because we waited a little too long to make those appointments. And then each vaccination may require more than one shot. So, and they have to be so far apart. And a pediatric patient may need multiple shots, and they can't do an accelerated schedule like an adult can. So that kind of put us in a time crunch because we had already booked tickets to Vietnam um, at that time. So we couldn't push our trip again. We had already pushed it once because I retore my hamstring, had another surgery. So we couldn't push our tickets again. So we had to really work our connections as nurses because we had worked with these doctors. Luckily, they got her in for the consultation. So we took Cambry in for her consultation, which in the United States, we all know how expensive healthcare is. Insurance will not cover this because it's considered optional. It's not a necessary treatment. So you're paying for a consultation fee. Our consultation fee was $350 per person. Now they agreed to see Cambry first, and of course Mark and I went with her. So we paid that initial $350 for Cambry to have her consultation. Then the vaccinations are also out of pocket cost. So we told them exactly which countries we plan on visiting or possibilities because we still don't have all of our plans lined up for the whole full year. So we told them all the possibilities that we may be visiting within the next year. So based on that, they told us what vaccinations they recommended we get for those countries and those regions of the countries. So we proceeded with Cambry's vaccinations at that point and what they recommended that she get. So what we found out was those are very, very expensive vaccinations in the United States. Of course, with her being a pediatric patient at 11 years old, we went ahead and paid for her vaccinations. But then Mark and I started thinking about it, and the Japanese encephalitis vaccine was alone $1,500 per person. And it's 2 shots for a pediatric patient. Then we had a typhoid vaccination that was also recommended. Now, for a pediatric patient, she could take an oral vaccination. For an adult, you can take a shot. So we got hers and we paid for hers. But we started thinking, now, why can't we get these vaccinations when we get to our first location? And since those vaccinations were not suggested for Vietnam, and we were coming to Vietnam first, Mark did some research and found out that we could, in fact, get those vaccinations in Vietnam, which is pretty exciting, actually. Because we made an appointment for the day after we arrived in Vietnam. We got the prices and everything. So we canceled our appointments with the travel clinic back home. We saved that $350 each for Mark and I, a total savings of $700 for us right there for no consultation because we already knew what we needed from Cambry's consultation. We found out that those Japanese encephalitis vaccines alone were only $38 each in Vietnam, as opposed to $1,500 in the United States per person. So you're looking at a huge cost savings right there. And coming up on slow traveling, quitting our jobs, selling our house and everything else we own, and living on a budget, we really have to buckle down and save our money because that is a whole month of living plus in Vietnam for us. Um, so we came to Vietnam. We went to the clinic the day after we arrived, or 2 days after we arrived. It was fabulous. It was super clean. We walked in, it was cleaner than the hospital that we worked in every single day back home. We waited less than 5 minutes to be taken upstairs to be seen by the doctor, who, by the way, spoke English. She spoke with Mark. She gave us free medical advice that we didn't even ask for, which was amazing because it was about our skin, about things we needed to know about Vietnam, just local advice that we really appreciated. And then she showed us, and we were going to show in the clips the way they store the vaccines. The nurse was very nice. They showed us how they refrigerate them, how they have a monitor in the refrigerator that alerts the cell phone. Somebody has that cell phone 24 hours a day. And if that refrigerator temperature drops below or raises above a certain temperature, it alerts the person with the cell phone 24 hours a day so they can address the problem immediately. If the refrigerator raises above a certain temperature or drops below a certain temperature or malfunctions in any way, it sends a message to the cell phone, and the person monitoring that cell phone gets a message immediately. The vaccines are the exact same Japanese encephalitis manufacturer that is used in the United States, Sanofi Pasteur. Um, and they showed us everything. The nurse showed us on the box the expiration date. They don't do that in the United States. They check your arm bracelet or they ask you your name and date of birth, which they did that too. And then they gave us the vaccine. Now, one thing we did not do was cost price point the typhoid vaccine in the United States for adults. We did pay for Cambry's oral typhoid vaccine back home, but we did also get the typhoid vaccine here in Vietnam. So the total cost for us for two vaccines, doctor consultation in Vietnam, per person was $43. $43 per person. Back home, it would have been for just one vaccine, and the doctor's consultation would have been $1,850, not including the typhoid vaccine. So it was a massive cost savings for us right there. So my suggestion is if you are going to travel and you are looking at paying out of pocket for your vaccines back home, call the country where you are going and see if you can get those vaccines in that country when you arrive, because you can save a massive amount of money. It's the same drug manufacturers. It's clean, it's simple, it's easy, it's super friendly. And we waited 30 minutes after our vaccines to be monitored, just like we would have in the United States. We were in and out within an hour. Easy peasy done. We had no reactions. Everything was smooth and simple. We would do it all over again the same way. We have a lot more money in our pocket. 2 months of living at least on that. Boom, done, easy peasy. And we're both nurses, so we would highly recommend it if that's what you're looking at. We would not change a thing that we did as far as our vaccinations go. We feel very safe and it was very clean, and we would recommend it for you too. Thank you for joining us today, and we hope you enjoyed our video and it's very informational for you. Don't forget to join us next time. Hit that subscribe button. Don't forget to turn on your notifications, and don't forget to be weird. It's more fun.